After knee school, you will attend a pre-assessment clinic. Here a nurse will go through a questionnaire that will assess your general fitness and find out about your medical history, your height, weight and blood pressure.
Now I just need to ask you some medical questions. Okay?
At pre-assessment you'll be medically checked, make sure you're fit and well, that you have no infections, and you'll have a chance to see your doctors and discuss the operation with them.
The nurses will do a number of things there. They'll do your blood pressure, they'll do urine tests as well. They'll also take a swab, a skin swab of your nose. We pride ourselves at the Basingstoke and North Hampshire Trust for having low infection rates, and part of the process of that is swabbing all patients prior to surgery. They'll also go through your medications about what you can and can't take prior to your surgery.
At the pre-assessment clinic, your doctors will also outline the risks associated with knee surgery and surgery in general.
Mr. Knott, hello.
This should not frighten you. This is a well-established procedure. The risk of serious complications is very small. The main risks associated with knee surgery are: there is a small risk that the wound may become infected.
Any break in the skin anywhere can allow bugs to get into your bloodstream, and the bugs can travel around the bloodstream and go to an area that's recently had surgery that will be more inflamed. So they may seed themselves into your knee replacement surgical site, and that cause an infection.
There is a risk that it may bleed. The knee may be sore or stiff after your operation and may still be somewhat painful.
Hopefully that deep toothache pain that's in their knee before they come in, the moment they wake up, it's gone. But it's sore, it's had a big operation, and it will be sore for anything from 10 days to 6 weeks. The average is 2 to 3 weeks that it's uncomfortable, and shortly after 2 or 3 weeks it usually improves.
You could have a blood clot or deep vein thrombosis.
We use AV boots to reduce the risk of blood clots. Blood clots are a potential risk after hip or knee surgery.
The chance of the patient having a serious complication with this type of operation is somewhere in the order of 1 to 2%. And in Basingstoke, we're extremely proud of the fact that we have a very, very low infection rate.
It is important that you read the section about risks and complications in the documentation that you have been given. If you wish to find out more about the risks of surgery, you can find all these documents in the downloads section of this website. And of course your medical team will be happy to discuss all this with you. After pre-assessment clinic, you should be sure that the plans that you made at knee school are all in place, ready for your admission.